There are many Indian baby care myths that are propagated by midwives and old grandmothers, but the truth is some of them could be causing your baby more harm than good. Myth 1. Newborns should be given honey at the time of birth. Fact: this is something that should be avoided at all costs, as honey should never be given to babies less than a year old. Science says that honey can lead to botulism in infants, as it is proven source of Clostridium bacteria that causes it. Myth 2. Infants should be wrapped tightly to straighten their legs. Fact: while this is a common practice, there is not research to back it up. Newborn wrapping might help keep the baby warm and comfortable, but the baby should never be wrapped tightly, as it might make him uncomfortable. Swaddling infants with the hips and knees in an extended position may increase the risk of hip dysplasia and dislocation. Myth 3. Kajal should be applied on the eyes and forehead to ward off the evil eye. Fact: this myth again stems from folklore, and there is no study that validates its effectiveness. Kajal can be harmful for your newborn's eyes and skin and might lead to an infection. Many households also use homemade kajal, which they make by keeping a spoon under the candle flame for some time and apply it on their newborn's eyes. This should also be avoided, as it can be harmful for your child's eyes. Myth 4. Breast milk can treat an ear infection. Fact: it's true that breast milk is loaded with antibodies, but they are not antibiotics for sure. So whoever told you to put some breast milk in your baby's ear to treat an infection, is wrong. Breast milk might in fact create a perfect environment for bacteria to thrive and complicate an existing ear infection. Always consult your doctor if you feel that your baby is in pain or has an ear infection. Myth 5. Adding Cerelac to your baby's feed would make him sleep longer. Fact: you should not be giving solid food and cereals to your newborn for the first 6 months of his life, and should breastfeed him exclusively. Adding rice cereals or Cerelac before the baby is 6 months old could be hard for him to digest and might give him a stomach infection. Myth 6. Newborns should not be taken outside in the dark. Fact: this is sadly again a myth. You should take out your baby irrespective of the time of the day, as your baby needs fresh air as much as you do. And fret not, there are no evil spirits or ghosts that would harm your child. Myth 7. Donkey's milk can boost your child's immunity. Fact: this myth is mostly common in the south of India, and there is no truth in it. Donkey's milk, just like cow's milk, must be avoided and in fact unsafe for your newborn, as it might give him a stomach infection. Myth 8. Teething can cause fevers and diarrhea. Fact: teething does not cause any kind of stomach infection or fever, and if your teething baby gets sick, it would be due to something else but teething. Also, babies get a stomach infection when they are teething, as they tend to put a number of things in their mouth to soothe their itchy gums.